from the Lakeside Newsroom of the Henrico Citizen, your hometown news source since 2001. This is the Henrico News Minute with publisher Tom Lapis.
Henrico begins mass vaccinations at Richmond Raceway. We'll have details in today's Henrico News Minute for Thursday, January 21st, 2021. It's brought to you today by Henrico County's COVID-19 Municipal Utility Relief Program.
And now for the news.
It was a big day yesterday at Richmond Raceway for Henrico County, which began its 3 days of mass vaccinations against COVID-19 this week. The county plans to inoculate about 4,000 people, at least with their first dose of the 2-dose Moderna vaccine. Educators and public safety officials from Henrico, Hanover, Richmond, and Goochland are taking part in the 3-day mass event. It started yesterday at 8 a.m. and ran for 12 hours. The same schedule will occur today and tomorrow. On Tuesday, the Virginia Department of Health had hosted its own vaccination event at the raceway. It marked the most intensive efforts of Phase 1B of vaccinations in the region and are the beginning of what county officials anticipate being a long-term effort to inoculate large numbers of people as quickly as possible. There's one big unknown, however, and that's how many doses of vaccine the county will receive week by week. Officials originally were planning to inoculate a total of 13,000 people this week at the raceway between county-run and VDH-run events, but that number was cut by more than half after the state adopted new guidance from the Centers for Disease Control to include those 65 to 74 in the second phase of vaccinations. That necessitated that available doses be spread statewide in greater numbers than anticipated. Previously, this phase had included only those 75 and older, as well as 9 groups of frontline workers. Henrico had requested 6,000 doses of vaccine for their own 3-day effort this week, but ended up with 4,000, according to Henrico Chief of Emergency Management and Workplace Safety Jackson Baynard. The county is prepared to administer as many as 18,000 doses at the raceway during 6 days next week, Tuesday through Sunday, but it's asked for 12,000 from the state and is hopeful to receive at least 8,000, according to Baynard. Those being vaccinated are scheduled in 15-minute increments, and groups are moved fairly quickly through the Old Dominion building at the Raceway complex. Yesterday afternoon, Baynard said that none of the people vaccinated as of about 4:30 had shown any adverse reactions afterward. Henrico officials opted to divide the number of registrants from the 4 localities proportionally each day based upon the population size of each county, according to Baynard. That was in an effort to be as equitable as possible in determining who would be inoculated when. He said it's likely that it would take at least 3 weeks of mass vaccinations at the raceway to finish the first round of shots for all those from the 4 localities among the 3 frontline employee groups who chose to receive them. Henrico Schools alone employs more than 10,000 people, and the county's police, fire, and sheriff's office employ several thousand more. State officials have been requesting upwards of 300,000 new doses of vaccine each week, but have been telling localities this week that they anticipate receiving only about 100,000 weekly for at least the next several weeks. You can read much more about this on henricocitizen.com by clicking on Government. Henrico reported 189 new cases of COVID-19 yesterday. That's the lowest daily amount of cases since early January. The number is still higher, however, than any single day of the pandemic last year. Henrico's now averaging 241 new daily cases in the past week. Yesterday, it also reported another 3 hospitalizations and 4 deaths related to the virus. Also of note, the week started with 8 ongoing outbreaks in Henrico, but that amount has more than doubled since, now to 19 in just a few days. 9 of those are occurring at long-term care facilities, 5 others in congregate settings, 2 in healthcare settings, and 1 in a child care facility. The county's positivity percentages rose sharply earlier this month, but those levels have retreated since. Among rapid testing encounters between January 10th and 16th, the positivity percentage fell to 8.6%, while among PCR testing encounters in the same time, the average was down to 10.8%. Well, as COVID numbers have been rising quickly in the last week or two in Henrico and the region, there's been some chatter online and through social media that Some local hospitals have entered a code red situation in which available beds are significantly limited. In actuality, though, local hospitals have not been overwhelmed by COVID patients. The code red term refers to a designation used by emergency dispatchers if a particular hospital is on what's called diversion status, meaning that it's unable to accept emergency patients for some reason. There have been a few local hospitals, though apparently none in Henrico, that were in that situation recently, but it's typically been short-lived, according to Virginia Hospital and Healthcare Association Vice President of Communications, Julian Walker. The VHHA uses 7 metrics to evaluate the operational status of hospitals on a 3-level scale, according to Walker. Level 1 is the conventional or standard level, Level 2 is contingency level, and Level 3 is crisis level. Walker says hospitals locally have been at the Level 1 status officially, but realistically have fluctuated somewhere between Levels 1 and 2 because of the uncertainties caused by the pandemic. Currently in the Richmond region, about 89% of hospital inpatient beds are occupied, and about 15.7 of those are occupied by COVID patients, according to the Virginia Department of Health. The former number is considered in the moderate risk zone and the latter in the higher risk on a 5-point scale. Walker and his team closely monitor the ICU occupancy levels of their member hospitals. It's 110 total statewide. Those generally have fluctuated around the 80% range, he said. On Wednesday, the VHHA reported them to be at 84% across member hospitals. Pre-pandemic, those occupancy rates were closer to 67% or so. Another factor, Walker said, is that with surge beds available for implementation at most hospitals that treat COVID patients, the actual capacity to handle ICU patients is much larger. There's about 842 surge beds in the organization's member hospitals, and if all of them were available, the ICU occupancy rate statewide would drop to just 57%. But he cautioned that simply having bed space isn't enough. Hospitals also must have enough staff to handle patients who might fill them. Illness and related quarantining can impact that, but the hope is that as more healthcare workers receive their second doses of vaccine, those problems will fade away to some extent. Next Tuesday, Henrico County Public Schools will hold another of its Life-Ready Expo series events. It'll take place virtually from 6 to 8 p.m. It's designed for students in grades 7 through 12 and their families. This one will allow them to connect virtually with business and technology employers across the region. Companies in the business management and administration field, as well as those in finance, information technology, and marketing will participate. If you or your students would like to participate, visit tinyurl.com/busman-technology. Today's Henrico News Minute is brought to you by Henrico County's COVID-19 Municipal Utility Relief Program. The program provides assistance for delinquent bills between March 1st and December 30th of last year. You can visit henrico.us to learn more and to apply by January 22nd.